Your doctor just handed you another prescription for anxiety. But what if there was something else? Something backed by clinical trials with zero risk of addiction and no sexual side effects that actually works. I'm talking about lavender, not the candle, not the essential oil in your diffuser, a specific pharmaceutical grade lavender extract called Silexan. And the research, it's remarkable. Hi, I'm Dr. Air, integrative psychiatrist and lifestyle physician. Let's talk about how well lavender works for anxiety and why most people are using it completely wrong. Stick around because I'll reveal the one mistake that makes lavender useless and the exact form and dose that clinical trials show works as well as prescription medication. But first, let me tell you about Rachel. She's 48, high pressure job, aging parents, constant low grade worry that never shuts off. She tried therapy, breathing exercises, even a prescription that left her feeling foggy and numb. Nothing helped the anxiety that followed her everywhere, from meetings to her daughter's school drop-off to lying awake at 2 a.m. Then I suggested something that sounded almost too simple: lavender. Not a candle, not a bubble bath, an actual clinical grade supplement. Within 5 weeks, Rachel told me she felt like herself again for the first time in years, a turning point she hadn't found with other approaches. So let's talk about how lavender helps calm anxiety and why the evidence is now catching psychiatrists' attention. Lavender isn't just a nice smell. It actually reduces anxiety in your brain. And for adults dealing with chronic stress, hormone changes, and a nervous system that feels overwhelmed, lavender can be a game changer. Let me explain how. Lavender has two special ingredients, linalool and linalool acetate. Think of these as tiny messengers that calm your nerves. Research shows that lavender mainly acts through 5-HT1A serotonin receptors, which help regulate mood and anxiety. Interestingly, studies show lavender does not work the same way as drugs like Xanax. That's why lavender doesn't cause addiction or make you feel sleepy during the day. A big study found that lavender led to real reductions in anxiety symptoms. But here's where it gets really interesting for adults like you. When you've been under chronic stress for years or decades, your nervous system becomes more reactive. This becomes more common as we get older. For women in midlife, estrogen, which helps control your stress response, starts to fluctuate wildly, then drops. For men, there's also a corresponding decrease in testosterone in midlife. In fact, studies show that testosterone levels in men decrease about 1 to 2% every year from the mid-30s. These hormonal changes leave your brain more open to anxiety, irritability, and that feeling of being on edge all the time. Lavender helps restore balance by calming your nervous system and working on brain chemicals that control mood. It lowers heart rate, reduces stress hormones, and helps your brain exit fight or flight mode. One study showed that a standardized oral lavender oil called Silexan worked as well as low-dose anti-anxiety medications and antidepressants for generalized anxiety, with way fewer side effects. No sexual problems, no weight gain, no withdrawal symptoms. But to get these benefits, there's one important detail to know. Not all lavenders are the same. That lavender essential oil diffuser in your bedroom, while it might smell nice and help with short-term stress, it's different from clinical grade lavender supplements used for ongoing anxiety relief. Research shows significant relief with 80 milligrams of Silexan oral lavender oil daily for 6 to 10 weeks. Aromatherapy can help with short-term stress, like before a dental appointment or a difficult conversation, but for ongoing anxiety, you need the oral form. Here's what I recommend to my patients. For ongoing anxiety, take 80 milligrams of standardized lavender oil, Silexan, once daily. Give it at least 6 to 10 weeks to see the full effects. Always choose high-quality pharmaceutical-grade products. Look for third-party testing to make sure it's pure. For quick stress relief or better sleep, use lavender aromatherapy, a few drops of pure essential oil on a cotton ball near your pillow or in a diffuser 30 minutes before bed. For massage and relaxation, mix lavender essential oil with a carrier oil such as coconut or jojoba and massage it into your temples, wrists, or shoulders. Lavender is remarkably safe. The most common side effects from oral lavender are mild, occasional stomach upset, burping, or lavender aftertaste. It doesn't mess with most medications, though if you're on sedatives or sleep aids, Talk to your doctor first. Lavender can make the effect stronger. And unlike prescription anti-anxiety meds, lavender doesn't cause addiction, brain fog, or withdrawal. Lavender works best when it's part of a whole person approach, paired with good sleep, regular movement, an anti-inflammatory diet, and stress management. Think of lavender as one tool in your toolkit, not a magic bullet, but a powerful helper in calming your nervous system naturally. For adults dealing with the cumulative stress of careers, caregiving, or the weight of holding everything together at work or home, lavender offers something rare, relief that's gentle, effective, and backed by real science. Rachel told me recently that lavender gave her something she thought she'd lost forever, the ability to feel calm without feeling numb. And speaking of sleep, because anxiety and sleep are deeply connected, I've created a free guide that walks you through the exact steps to improve your sleep naturally. You can download it in the description below.